If you've been on TikTok or Instagram lately, you might have heard the term Ozempic tongue. People are saying Ozempic is causing things like a metallic taste, a bitter or sour mouth, tongue irritation, and/or changes in how food tastes. So is this real? Is Ozempic damaging your tongue? Or is this another scary viral term that needs context? Let's talk. Hi, my name is Whitney and I'm a registered dental hygienist here to talk about Ozempic tongue, what it actually is, why it happens, and what you should and shouldn't be worried about. First things first, Ozempic tongue is not a medical diagnosis. It's not an official medical term. It's just a phrase used to describe some oral symptoms some people experience while taking GLP-1 receptor agonists like Ozempic, Wegovy, Mounjaro. Of course, Ozempic being the popular one in the media, well, they're all kind of becoming popular, but we've all heard of Ozempic. Now, this doesn't mean the symptoms aren't real. It just means the name can be misleading. So when people say they have Ozempic tongue, they are actually describing things that can happen from any of those GLP-1 medications, such as the persistent metallic, bitter, or sour taste, like we said, food tasting off or bland, burning or tingling sensations, dry mouth. Honestly, dry mouth can happen from a multitude of medications. I'll link that video of mine below. And of course, tongue sensitivity or irritation. Now, yes, experts do acknowledge these symptoms. I just read something on the ADA news page where a spokesperson for the American Dental Association was talking about how when medications are absorbed into the bloodstream, released into saliva, and interacting with taste receptors, how this can alter the way things taste. And the spokesperson also emphasized that many medications, like we said, not just GLP-1s, can do this. There was also a small study that I found published in Physiology and Behavior that talked about GLP-1s altering perception of sweet, sour, salty, bitter, umami, savory, all the tastes. So why does this matter? Why am I making this video? Because these medications are not damaging the tongue itself. They are more likely than not actually changing how your brain interprets taste. That's a big difference. And from an oral health perspective, this is usually multifactorial. It's not just the way the brain is interpreting your tongue. Other common contributions are, like we mentioned, dry mouth. People on GLP-1 meds often eat less, drink less, and feel nauseous, meaning less saliva equals more irritation, altered taste, and microbial imbalance. So here it's the tongue itself plus the brain interpreting the tongue. Multifactorial. It's not just the medication making this happen. It's also the lifestyle changes. Same with nutrient changes in general. Rapid weight loss and reduced intake can lead to low vitamin B levels, iron, zinc, all of which can cause burning tongue, soreness, taste disturbances, and lastly, reflux. GLP-1 meds slow gastric emptying, which can increase acid exposure, another irritant for oral tissues, a physical alteration in your mouth. So there's a lot of things going on and changing when you're taking the meds. It's not just the meds themselves. Having said that, to recap, if you are having tongue issues while taking this medication, please know that it is not tongue damage. It is not erosion. It is not permanent. And it does not mean the medication is harming your mouth. In most cases, symptoms improve over time or resolve when the medication is stopped. Experts agree that discontinuing the drug typically resolves the taste changes. But what can help if you want to stay on the medication? It's recommended to stay well hydrated, maintain excellent oral hygiene, brushing and flossing daily. I will link my free oral care guide below if you want tips and tricks to make sure you're doing all the things the best way you can at home. In addition, gentle tongue cleaning, not aggressive scraping, avoiding alcohol-based mouthwashes, and seeing a healthcare provider if symptoms persist. If there are white patches, burning pain, or sores that don't resolve, get evaluated. It's better to have a professional let you know what they are seeing versus you guessing. Overall, Ozempic tongue describes real symptoms, but it's a misleading label. For most people, this is about altered taste perception, not damage to the tongue or teeth. And I hope this video helped clear up some of the confusion. Thank you for watching, and if you enjoyed this video, please like, subscribe, and turn on your notifications. And if you want even more teeth talk, you can visit my website teethtalkgirl.com and hang out with me on Instagram at teethtalkgirl. Peace, love, and teeth.